So what are we doing?
Extended tongue tuck.
An extended tongue tuck, right? Wow. What do you see, Wendy?
I see no blood.
No blood, right? It's white, right? So
It's white.
it's incredible, huh? How beautiful this is, you know, the way we do this at the Cosmetic Surgical Center for Cerrito, and I'm completely. Look at that, huh? I love the colors, right? So you have white, right? And now what color you see?
Yellow.
Yellow, right? And what is that yellow?
Fat.
That's the fat,
Adipose
right?
tissue.
What we call the subcutaneous fat, right? But normally this would be all, with a different technique, you know, this would be all red. It would not be yellow, it would be red from all the bleeding, right? But because there is no bleeding, this is a very, very unique technique, I think, where we do this, you know, we teach it to other doctors, you know, and some doctors don't even believe it, you know, they go, I gotta come and see it. How does he do it, right? But it's no secret, you know, it is a combination of things, right? Is what we start by telling the patient, so the patient is important to follow instructions, right? We tell them not to take any vitamins, no herbs, no aspirin, no ibuprofen, and that's important, you know, because if they're taking aspirin, you know, or ibuprofen, or even vitamins, you know, they're gonna bleed. So that's important. What the patient does is important, right? Follow instructions. And then the surgeon also we put tumescent anesthetic. And thanks to Dr. Klein, this anesthetic is incredible and revolutionized the way that we do surgery. I want to thank Dr. Klein for that, because he invented this technique, which is called the tumescent anesthesia technique, right? So we put numbing medicine. You see a little bit of little bleeders on the skin. We take care of that too, right? So there is no bleeding at all. And this tumescent anesthesia has lidocaine, so the patients have much less pain. Most of them don't even use the prescribed pain medicines, right? And they're walking 1 mile the first day, 2 miles. Preventing a blood clot, right? A blood clot is the one thing that can kill you. So if they're walking, they are basically moving the blood. As the muscles contract, they move the venous blood from the legs to the heart and to the lungs, preventing a blood clot. A blood clot is the one thing that can kill you. And thanks to God, we never had anybody die, and we want to keep it that way. Look at the ocean of tumescent that we have here. See, it's all wet, but normally it would be all bleeding, right? But this is just tumescent anesthetic, right? Yeah. Look at that. And so what is this membrane over here that we just went through, Gabby? This one over here?
Fascia.
The scarpus fascia, right? And so scarpus fascia divides superficial fat from deep fat. So we're approaching deep fat right here. And I don't know if you can see. I'm going to maybe angle the calories so you can see better. The rectus abdominal fascia, right? Look at that. And I can already see it. See that white membrane right there? You see? You see the white? Once you focus real good. Can you see that white?
Yes, doctor.
Yeah, so that's the strong membrane that protects the intestines, right, in there. And so, but we do this in a totally controlled manner. And you know, the thing about it is that if we didn't do it this way, all these white would be red. All these would be red from all the bleeding. And it doesn't take much, you know, just one little blood vessel pumping at high pressure, man, can give you a lot of bleeding, right? And it stains the whole thing. Thank you. Okay, so this is the rectus abdominal fascia, that white membrane that you see there. What Gabby got on her hand is the specimen. That's what we're going to remove, right, Gabby?
Yes.
But notice how much blood loss do you see there? None,
No
huh?
blood.
Incredible. No bleeding here. But look how careful I am. We go very, very slow. And we do this in a very, very, you know, careful manner so that there is absolutely no bleeding. And at the end of the day, even though I go slow, our timings are pretty mighty good. I think, you know, even, you know, very, very good timings. And the reason why is because I don't have to go look for any bleeders. I can see the blood vessels so, so clear. It's like, I don't know, like flying during the bright day light. I would think where the line, this brown line, that's called the linea alba. And it is basically brown line that develops right after the pregnancy, right, Gabby? You see the blood vessel right there, Gabby? You see that little blood vessel right there?
Yeah.
Just show it to them. So we are electrocoagulating that little blood vessel so it doesn't bleed. See, there's another one right there. So now when we go through it, you can do this in a completely bloodless manner. Look at this, see? This is incredible. But that's the way we do it here at the Cosmetic Surgical Center of Cerrito. See, these black little dots are the blood vessels that we have electrocoagulated, but this is just incredible, you guys. I mean, normally, if you do these with a different technique, that what we have here, like I said, all these will be totally red. I mean, like totally red. It's incredible, but this is just a beautiful. We do this pretty much on a daily basis, but I'm amazed on a daily basis, I'm one of those guys that I see an airplane fly and I go, wow, how do they do that, right, Gabby?
Yeah.
Look at these, show them. No bleeding at all. We're gonna go around the belly button. And it just gives me pleasure to do surgery like this. It is so elegant, so nice, so clean, so pristine. But more than any of that is I can see the image of God in here, right, Gabby? I can see God's creation, how beautiful He made us, right? And like a beautiful belly button that she has, we are going to basically keep it, right? We're going to keep her belly button, we're just going around it, and we're going to join these two right there, you see? And now, we're going to go and peel the belly button, right? This is a little blood vessel there. I electrocoagulated, right? And we're going to peel this belly button. You see this blood vessel right here? That's a branch of the inferior epigastric artery. So we're going to clamp it, So what I go right under it and then clamp it. And I clamp it on Gabby's side, right? And I'm going to go and do the same thing and clamp it now on my side. And now, this is the biggest artery providing blood supply to the specimen, which is what Gabby has in her hand. And what I'm doing here is I'm burning it, right? I'm electrocoagulating. This is electricity. So it electrocoagulates, it burns it, and you see the fire there? And I'm gonna go through it now. And you see the fire? And now, do you see any bleeding? That's because, and it's completely, that artery is the biggest artery around here, and it's being completely divided without a single drop of blood, and keeping everything nice and clean. And I release, and there is no bleeding, and now we just keep going, right, Gabby?
Yeah.
This is just incredible the way we do this here at the Cosmetic Surgical Center of Cerrito. That's the biggest artery around here, providing blood supply to the specimen, which is what Gabby has in her hand. So this is how we do it here at the Cosmetic Surgical Center of Cerrito. Thank you. Okay, so let me show you how bloodless this is. This is your belly button right here, and look how weak this is. We're gonna basically make all this tight. This is an extended thumb tack. Thank you. Now what we're doing is we're marking the area that we are to excise or remove, right, Gabby?
Yeah.
So Gabby is bringing this down, and we're gonna go down to here, see? So that's gonna be our area that we're gonna remove. And this is the pubic hair, you see that? Shaved hair. So this actually belongs over there, right over there. So look at all these stretch marks. We're gonna remove. She's still gonna have some stretch marks up here, but at the end of the day, look how tight and nice she's gonna be, right? All these out. Thank you. Okay, so what are we doing now, Gabby?
Marking where we're gonna excise the specimen.
Yeah, exactly. So as Gabby pulls, I'm gonna go down to here and take all these. You can see the stretch marks here too. See, stretch marks. And when we take that out. She's gonna be nice, tight, and almost free of stretch marks. She has some in the middle, unfortunately, that she's gonna keep, but she's gonna look a lot better after we remove these. Thank you. Okay, so Gabby, we decided to make this line a little higher, right, Gabby?
Yes.
Because we did the measurements, and she can take a little higher of a resection. So the more, the better, right? We're gonna take a little more. As long as we can close, that's the ticket. Thank you. Okay. So notice how we're using a number 10 blade. This is a very sharp blade. It's a knife. We call it a scalpel. And do you see any bleeding there? This is incredible, right? This is the way we like it here at the Cosmetic Surgical Center of Cerrito. So I'm gonna show you how we do this. You know, this is incredible. Show them the yellow part, guys. Yeah, this is incredible. See, look at that. You see that? Is that what you're focusing on this?
Yes, we are.
Wendy? Yeah. Beautiful, right? Look at that. Gorgeous.
This is the specimen that we took out from the right side. Here you can see some stretch marks on the bottom. And here's the fat side. Thank you.
So what are we doing now, Gabby?
We're making a new home for the belly button.
That's right, huh? Look at that, huh? So where's the belly button, Gabby?
It's sitting right underneath.
Right under it, right?
Mhm.
So now, because we remove the skin and fat around the belly button, right, Gabby?
Yes.
Now we're gonna go ahead and make a hole for it to come out. Thank you. So now my finger is under it, right where the belly button is. And I'm gonna go down to my finger, and then my finger is gonna come out, right? Right now, my finger is gonna come out. See? Hello?
Hey.
I like that part. Funny, huh? Thank you. All right, do you see the number 8? That's a figure of 8 O-proline suture. And what we're doing is we're approximating the rectus abdominal muscles, which are basically the six-pack that the athletes show. Only in women they separate during pregnancy to make room for the baby to grow. She's not gonna have any more babies, so we're gonna bring them back together in the midline, right, Gabby?
Yes.
And we do multiple of these figure of 8 sutures because if one of these sutures were to break, then we have a supporting suture on either side of that broken suture, right? But so far, thanks to God, we never had any of these sutures break, but I am just an extra safe surgeon. It's a lot faster just to run this stitch down, you know, in a few seconds. This takes a lot longer, but I prefer this way because of safety, you know. I think it's better this way, and that's how I always done it. But you know, other very famous and good surgeons, friends of mine, just do it in just one single running suture, very fast, right? And this is your belly button right here, and I'm putting the sutures inside. You see any bleeding?
No bleeding.
That's your belly button. And notice, come from the side, like this side, and lower yourself down so you can see the bulge here. See?
Yes.
That's intra-abdominal fat that we're gonna push in like that. Thank you. So right now what I'm doing is, see, I'm holding the line there so that it's easier for me to go back to the same place, right, with the figure of 8. You had a question, Wendy?
Yes. So, doctor, you mentioned that she's planning not to have any more children, but what if she actually does change her mind? What would happen?
Yeah, God bless her. That's a good thing to have kids. It's a blessing from God. So nothing really happens to the baby. Nothing really happens to her. But of course, you know, she probably will develop stretch marks again, right? And she probably will, you know, need a revision of her tummy tuck, right? But notice the complete absence of bleeding when we do this, and notice how these and I'm gonna finish up later, but this stitch right there, see, when we finish, look how flat she's gonna be. I think if you come from, I'm just gonna keep doing it. Thank you.
Doctor, show me the bulge when you push it in one more time.
Yeah, so that bulge here, when we push it in, it's gonna be like that. And we'll
Very
show you
nice.
later on, but it's incredible. Yeah, thank you. Okay, so here's your belly button sitting right there in the middle, and that's the rectus plication that we did above and below the belly button. And look how nice and tight she is right here. She's not, you know, and flat, totally flat. Thank you.
Beautiful already.
Okay, so what are we doing now, Gabby?
We're making the incision. We're going to put the drain through.
Yeah, this is a 10 millimeter Jackson-Pratt drain that Gabby's giving me, and I pull it through. And notice, do you see any bleeding there?
No
And
bleeding.
look at that belly button over there. Beautiful. Huh?
Beautiful
Thank
already.
you. Okay, so now we're gonna make an incision here, okay? And same thing that we did on the other side, right? That's electrocautery. You see that there is absolutely no bleeding when we do these. And that's a mosquito clamp. And Gabby gives me the 10 millimeter Jackson-Pratt drain. We pull it through. She looks incredible, no bleeding. Look at that belly button. She looks great. We're gonna close. Now look at, too bad we already covered that area, but I just want to show you that suture line, how beautiful that is, how meticulous we are when we do these here at the Cosmetic Surgical Center of Arteries. So this is a triple layer suture, and this is the very last. Look how beautiful the skin comes together.
Very nice.
And this is the last suture, and no sutures need to be removed, right? These are self-absorbable sutures, so they come out on their own, right? They basically, the body absorbs them. Look at that, beautiful, huh?
Very nice.
Yeah, that's what. But we take our time, and yet look, we're making real good timing for this extended tummy tuck, right?
Absolutely.
We're almost done.
Very
Yeah.
meticulous
Yeah.
work.
Incredible, huh? Thank
Only
you.
here at the Cosmetic Surgical Center of Cerrito.
You betcha. Thank you, Wendy.